Hello and welcome to Archaeology 101. Today's topic will be looking to the fascinating yet grisly subject of what is described as the world's first neurosurgery, and that of course is trepanation. We will be looking into various case studies of those who have had trepanation performed on them in prehistory and going into some of the explanations as to why people underwent this incredibly risky procedure. Trepanning, or trepanation as it is simultaneously known, is the process of removing a piece of the skull, which usually manifests as a circular or square hole. The practice dates back to the Mesolithic period, and there are examples all over the world of this practice, such as North Africa, where one of the trepanated skulls from Taforalt, which is in Morocco, was discovered dating to around 10,000 BC. Despite the risks of undergoing such a procedure during prehistoric, pre-anesthetic times, it's not an uncommon procedure, and there's at least one estimate that suggests there are around 1,500 known global prehistoric cases of trepanation. There are several different methods that you can trepan a skull. The one which perhaps you most commonly think about is using a drill to drill holes into the top of the head, and you would be right. If you look at the image here at number 3, the drilling method combines a multitude of different small holes drilled into the skull to make a small circle. Once all those drilled holes link up, that piece of skull can then be lifted out. Drills in a pre-Black & Decker society may have looked something like what Primitive Technology made in one of his videos. This is a cord drill, and it's a simple design of a stick with a sharp piece of stone at one end, and then a weight stone at the bottom, and then 2 pieces of string. And by pulling the 2 pieces of string, you can make the stick spin, and you can drill through most natural materials such as bone and stone. Going back to that diagram, method 1 shows scraping. For whatever reason, this method really sets my teeth on edge more than the other ones do. Scraping in the millennia prior to metal blades was performed using the edge of a sharp flint or similar type of stone, where the skin across the area to be trepanned was sliced and peeled back, and a sharpened stone was then dragged repeatedly across the skull. This process is slower and creates a larger hole than drilling. However, the one benefit is that there is less risk of accidentally penetrating the brain as you are slowly peeling back the layers of bone. The image of the skull on the screen here is of individual A53. A53 is a late Iron Age Swiss skull, and it was found that A53 had undergone scraping trepanation, which is highlighted in yellow. However, A53 also underwent drilling trepanation, which is highlighted in red. It's quite likely that the trepanation was performed due to medical reasons. The archaeologists examining individual A53 identified a small head lesion, which indicates that this was the purpose behind the trepanation. When examining the trauma sites, the archaeologists could not find any signs of healing, which indicates that individual A53 unfortunately perished either during the procedure or very soon after it. Grooving and cutting are the other 2 methods of trepanation, and they're very similar to one another. Cutting, for example, in a linear fashion is a method that was very common within the prehistoric populations of Peru, and you can see the example of the skull here, which has had a slightly rectangular piece of skull removed, where thick lines have been gouged into it with a sharp piece of stone, and that piece of skull was then removed. Grooving is in a similar fashion, but a little bit neater, as you can see in this example, which involves just repeatedly going round and around in a circle with a sharp piece of stone. This was actually the preferred method of trepanation in French Neolithic examples, scraping being the second most popular method. It really does boggle the mind to think that individuals were able to survive a horrific, for all intents and purposes, neurosurgery with only bone and stone tools to cut through their scalp. How long people were able to survive after trepanation is unfortunately not well understood, and this stems from our own limitations in understanding of bone regrowth in the skull. We could not look at a trepanned individual and say, yes, this individual is 30 days post-healing. Other factors also cause uncertainties, such as the interruption of the healing process by infections, so at the moment the science is not precise. Having said that, there are very fascinating studies beginning to emerge that are beginning to delve into survival rates of prehistoric trepanation. One such study by Dr. McAdam and her team looked at trepanned individuals of late Iron Age Switzerland. They took a sample of 34 individuals who had experienced trepanning and looked for evidence of healing within the trepanation site. The ensuing analysis revealed that out of the 34 individuals, just under 80% of them showed signs of healing around the trauma site, which means that the majority of individuals who underwent trepanation in late Iron Age Switzerland actually survived the procedure. Of course, they would have had metal tools to undertake the trepanation, but it's still incredible that pre-antibiotic era that such a high number of people were able to survive, even if for a short period of time. Similar studies actually suggest that if you were to undergo trepanation during the prehistoric period, you were most likely to survive if you underwent the scraping method. Although it was possible to survive trepanation, there were many who didn't. And you can even see that within the archaeological record, where there are partial trepanations. This example here is from Adlestrop Longbarrow, which is in Gloucestershire, where a individual has begun to have the trepanation process performed upon them, but then presumably that individual has died and the trepanation process has not continued. The amount of trepanned skulls in the world is small, but significant in number to confirm a working knowledge by many different prehistoric cultures across the globe on how to quickly and effectively perform this procedure of trepanation. There is possibly an example of somebody trying to practice their trepanation skills, and this comes from a cow skull that was discovered at a French site called Champ-Durand. This cow skull has a large hole within it, which was caused by the scraping method. And there are two hypotheses laid out by the French researchers who wrote the paper. The cow may have already been dead, in which case the procedure was entirely to practice trepanation. Alternatively, the cow was alive and the procedure was a medical intervention for the animal itself. If this was the case, the animal did not survive the procedure. So what were the reasons for undergoing an incredibly painful and dangerous procedure? Many articles suggest that trepanation was the earliest form of neurosurgery, the aim of the surgery likely to relieve the pressure on the brain, which may come from either fluids or perhaps even a fractured skull which is depressing onto the brain itself. In the prehistoric South American examples, this concept of surgery certainly rings true, with around half of all trepanned individuals presenting some form of head trauma. This picture of trepanation being purely for medical reasons really becomes obscured when going across the pond to prehistoric Europe. Prehistoric Britain is perhaps the biggest culprit when it comes to this point. A study shows that out of all of the prehistoric trepanations on the island, not one of them shows signs of cranial trauma, which would warrant them undergoing a procedure like trepanation. Where there is an absence for a physical explanation for trepanation, archaeologists have deferred to trepanation being used to treat neurological conditions. Ancient Greek text in the early 2nd century, for example, certainly shows that trepanation was used for sufferers of epilepsy and seizures, and therefore logically it could be that trepanation was used for the same purposes in prehistoric times, or perhaps even other mental illnesses such as schizophrenia. We do have to consider, though, that there were even less tangible reasons for trepanation, which are the religious and cultural practices. Martin Smith and Megan Brickley, in their wonderful 2009 book, People of the Long Barrows, pondered if trepanation was the process which had magical and spiritual meaning in certain cases. It may well have been the case for many prehistoric cultures that medicine and spirituality were entwined or at least in some way related. Some of the earliest researchers into trepanation have already considered this factor, and this is where you get that classic idea that putting a hole into someone's head would release demons or evil spirits from the opening that were causing some malady in the physical body. That's been a basic discussion on trepanation, and I think we should conclude holes and heads there. People have been drilling holes into heads for a very, very long time. Even into the modern day, modern medicine still practices trepanation. The practice in the past seems to have been medical in some cases, as we saw in Peru, but in a lot of different cases, like the British examples, there isn't really a logical reason for trepanation, but that may pertain to neurological conditions such as epilepsy, which do not have an obvious archaeological trace. But there's also the very distinct possibility that trepanation also had other cultural or religious purposes. The overlying trend, however, is that trepanation is fairly universal, and even in pre-metallurgic societies, the procedure could be performed to a very competent level with stone and bone tools. Despite the brutal appearance of trepanation, it likely reflects a deep level of care and was probably not undertaken lightly in most cases. There is, of course, so many questions left unanswered. Paleopathologists are doing their best to perfect research techniques, and going forward they will develop new methods which may help to answer big questions, such as accurately predicting how long somebody could survive after trepanation. A question I am particularly intrigued by, but undoubtedly very difficult to answer, is whether there was medication involved in prehistoric examples of trepanation, narcotic herbs perhaps, or maybe something as simple as alcohol once agriculture had arrived, that would help to reduce the pain experienced by a potentially conscious individual undergoing the removal of tissue and bone from their skulls. And that's where we shall end prehistoric trepanation. Be thankful that you live in a time of anesthetics, antibiotics and modern medicine, and hopefully you will never ever have to undergo having a hole bored into your skull. I hope you enjoyed this and learnt something new about the gruesome world of prehistoric trepanation. Thank you ever so much for watching, and I hope to see you all in the next episode of Archaeology 101.